No, it just doesn't feel right. Assalamu alaikum, everyone, and welcome to tonight's program. My name is Malika Mukhtar, and I will be your host tonight, inshallah. With me is Sister Sarah Walji, and we shall be exploring mental health. Tonight, we are here as the Africa Federation Tabligh Board Social Vices Subcommittee to explore how mental health issues can affect our community. Just to brief everyone, the Social Vices Team is a body that operates under the Africa Federation Tabligh Board and is charged with tackling issues related to youth, which are more often than not left unaddressed and can be really stigmatizing. Today, we want to understand issues revolving around mental health, and to do that, we have invited a special guest, Sister Sarah Walji. Welcome, Sister Sarah. It's a pleasure to have you on board. May I ask you to take a couple of minutes to introduce yourself to the audience, please?
Thank you, Malika. Really appreciate the invite and the opportunity to work with you guys on this. I think it's a great initiative, and I think today's discussion will be very fruitful. As many of you know, my name is Sarah Walty. I'm currently a registered nurse. I work in an emergency psych settings, so my specialty is psychiatric care and crisis-based intervention. I also work with public health, so a little bit of juggling between the two roles right now. I'm finishing my master's degree within the world of global health. My area of interest particularly focuses on mental health pertaining to culturally sensitive communities and gender-based violence. So inshallah, we will be bringing forth discussion points of interest that I have personal passions within, and today's discussion will be great.
Inshallah. Thank you so much, Sarah. This being an area you are very familiar with, I'd like to ask you to give our audience a brief overview on mental health so that we can all start on the same footing, inshallah.
Right. So oftentimes I do like to ask my audience what they perceive mental health as. Unfortunately, we don't have that platform and that opportunity to engage in this setting. But mental health is basically the emotional, social, and psychological sense of well-being. It's a state of well-being that goes beyond the physical form, and oftentimes it is overlooked within the physical sphere of health, and we don't necessarily delve into it. If we're going for a checkup for something like a broken arm, we aren't going to start talking about discussions pertaining to mental health. So it is kind of something that requires a little bit more of an in-depth discussion, and something that we do take a little bit more time and a different route of care within when we do engage within these dialogues. The factors include biological influences, so this is your gender, hereditary information, past history, genetics. They do play a role within mental health, as well as social impacts and societal factors. So the community at large, our households, our societies that we're connected with, things that surround us, and the communities that we do engage with, the education that we're going through, the homes that we've grown up in, all of that influences your mental health and state of well-being, as well as different factors and different obstacles that we do encounter throughout our lives. And these can be within our work life, within our family life, within our personal life, struggles with substance use, for instance. Substance use includes alcohol, drugs, etc., things like that. Different societal circles that we do become connected to, so different communities that we do engage with, our friends, how our peers shape our lives, and all that impacts you on a different way and leads to a state of either mental well-being or mental unwell-being. And the state of mental unwell-being, as many of us know, is also known as mental illness.
Right. That's actually ties very well with my first question for you. There are a number of social vices within our community, such as substance abuse, you mentioned, emotional abuse, could be identity crisis, sexual perversions. But what do you think, in your opinion, how well does it link with mental illness? Maybe you could give a broad overview on that.
Yeah, I think all that really plays a wide role into your mental health and well-being. Again, the society at large, the way it impacts you, a lot of people don't think they're influenced by things around them. But when that becomes a part of your norm. It shapes you for years and years and years. None of us grow up isolated on an island in the middle of nowhere, completely not surrounded by individuals around us. We all have individuals around us. If you're growing up completely alone and hermitized, then that's a different story, but many of us don't. So that plays into how that impacts you and how that molds you as an individual, how that enables you to cope. When you see people around you with ineffective coping or ineffective means of coping, or different means through which they engage within. So for instance, if you grow up in a friend group where alcohol is accepted, who's to say that you wouldn't entertain the thought? Who's to say you wouldn't entertain the act? And who's to say that you won't build a dependency on it and that won't become part of your life? Again, I'm not speaking from the perspective of somebody that's grown up with religious values. I'm speaking from the perspective as an individual who is a clinician within the field. It is something that impacts you. It's something that impacts our community as well. Whether we choose to accept it or not is a different story. But that being said, it's the community through which you're engaging within, the society at large, and the network that basically connects you to the world. Drugs, for instance, is a huge one. I know that many countries, especially Western countries, especially the country that I'm currently in, Canada, we've legalized marijuana. So it's been culturally accepted. Now, religiously, it's a different story, but the fact of the matter is that within many friend groups, within many community groups, within many educational groups, especially in high schools and university, as you enter into university, it's become something that's very normal to go into that environment and say, oh, here, do you want some of this? It's very accessible. It's legal. You can buy it off the road kind of deal. And it's not something that requires an extensive process as long as you meet the age requirements and you do have an ID. But that being said, whether or not we engage in that is going to be based off of our values, our stances, our previous life experiences, how we do have that connection with what we view as valuable within our spiritual life as well. But oftentimes that pattern of behavior can lead to negative ramifications long term. It can lead to poor dependency, poor means of coping. One drug leads to another drug, and then you end up with that pattern of substance use over the long-term duration of time. A lot of people actually turn to marijuana now because it's a means of coping with anxiety and depression. It actually has residual effects. Oftentimes you end up being a lot more anxious. You end up being quite subdued, and it brings about the residual effects that people don't really acknowledge till they're in that state of panic and worry. Oh, I don't do anything beyond smoking the odd couple of joints when I'm anxious. That has the residual side effects that we got to look at over the long term. That might not be the most appropriate means of coping. In addition to that, sorry, go ahead.
No, that's okay. So basically, it is intertwined. Whether sometimes it starts with substance abuse or any kind of vice that could lead you to mental illness, or vice versa. You could be having some social issues within the community, and that could have been a trigger, or something could be another trigger, but what your coping mechanism could be a social vice, such as substance abuse, as you explained. So it's like an unending circle of vices.
Yeah, they say about 50% of substance users actually suffer from some type of mental health-based condition or have some previous mental health-based condition. So there is a heavy interlink between the two.
Yes. So this is the month of Ramadan, and as we know in the Islamic spirituality, the bond between believers is more than just of companionship and friendship. It's more of a spiritual kinship, which transcends all ethnicity and race. The goal of the Muslim community is somewhat to be perfect and grow towards Allah subhanahu wa ta'ala, especially in this month. So what would be a harmony between all believers makes this journey much, much more sweeter. The Holy Prophet ﷺ is reported to have said that a Muslim is the brother of another Muslim. He does not oppress him, does not humiliate him, and does not leave him to face his hardships alone. However, it is so sad that within our communities, we often hear that those that are unfamiliar with the severity of mental health, they usually stigmatize those suffering from the disease, such as depression, anxiety, and causing them more harm. What would you like to say to such people?
So unfortunately, there's only so much awareness that you can have with those people. It's not a conversation that's accepted by everybody. Mental health is a very, very stigmatized topic amongst healthcare professionals that have studied it for their entire life. It's something that either you come to terms with, you accept, you have that dialogue, and you further that discussion with, or it's something that's negated and not something that's very, very open to that person. But what I find in the communities at large now is that we're streamlining towards the conversation of at least having this dialogue and becoming more aware. And if that's going to change a view or not is a different story. But as long as we're getting the awareness out and the message out and saying that, hey, it's an issue that does persist, I think that's valuable and that's important. Generationally, we do see generational gaps. So that's something that's evident, not saying something to pin one group against another, but it is widely accepted. We do have these conversations a lot more persistently amongst youth and younger generations. And individuals in their middle ages, individuals in their more senior years, this is a conversation that's become very new for them. Ironically enough, a lot of seniors that I do engage with are actually very open to discussing topics around mental health, which has been really, really great. I think they primarily focus on the depression and the anxiety piece, and maybe the other broader concepts in mental health where we're exploring things like psychosis, suicide, persistent types of compulsive behaviors, things like that. It might not be as understood, which is fine and acceptable. But we are having these conversations and they are coming forward and they're tackling it from their own networks as well. And I think that's something that's also important. It's not youth talking to youth anymore. It's, oh, let's integrate individuals from all walks of life so that we can have that discussion across the table and across the board. The other thing that I think is really valuable is to include healthcare providers and practitioners who do have a background in this area of expertise that do come from within our community. And I'm not just saying that because I'm one of those, but it's also because we understand the community. I've grown up in the community at large. I've been exposed to the vices. I've been exposed to the stigma. When I was starting out my career, a lot of people questioned why I wanted to pursue mental health. And I said, you know what, I love it. I have a passion for it. Not only that, but it's actually very present. And a couple of people looked at me like I was a little bit off my rocker. And I was like, no, you'll see over the years as it comes through, you'll see a lot of prevalence for it. And it has, alhamdulillah. We've been very blessed where we've had a number of younger individuals go down the streamline of becoming mental health providers, becoming nurses, becoming clinicians, becoming psychiatrists, becoming psychotherapists, becoming counselors, social workers, whatever it is. It's a comprehensive based group that does work together on different layers. And it's not closing the door to one practice over another. We got to include them from everywhere. There's a medical component to it. There's a community component to it. There's the emotional well-being component to it. So there's a means of everybody fitting into this dialogue, but we also got to access the resources that we do have with trained practitioners.
Yes, I guess with our older generation, it was something that was not discussed because maybe of the lack of expertise at that time. I'm sure they had a lot of cases that resemble, and now they realize that, oh, this was going on, and we just didn't realize. Rather, we thought maybe something else is wrong, and but now it's something that people have come up with, and they have actually seen there is conditions that can improve with help when given at the right time. So it is really, really a growing topic. And also, as you said, professionally, many of our community members are already in it. And inshallah, we hope to help as much as we can. Even us as the Social Vices Committee, we are just here to be able to help youth come to us in a safe space whereby they can actually connect and talk about these topics and actually come forward where we can try and help them in any way possible. So to the audience, I'd like to say you can join us at our Facebook page and our Instagram page that is Virtual Safe Space. And inshallah, together we can work on these issues. Sarah, in extreme circumstances, people afflicted with mental health begin to question whether they actually deserve the blessings that Allah subhanahu wa ta'ala has blessed them with, up to the extent that they start including that whether they deserve their own life or not. What I'm really trying to say is that they start getting suicidal. What do you have to say about to someone who comes to you and says they feel this way?
Well, that's actually quite a frequent conversation with me, unfortunately, as fortunate as that is. A lot of people come when they're at their extreme lowest, and that's kind of when I have conversations with them. So it's persistent thoughts of suicidal ideation, these thoughts of wanting to end their life, seeing no value, no worth, extreme hopelessness. You're not really focusing on things that might have previously been protective in your life previously to that point when you are in a state of crisis. So in instances like that, I do remove all stigma surrounding the topic. I know in our communities, suicide isn't accepted. It's haram, right? So we're not somebody that's going to be like, oh yeah, okay, that's fine. It's not. And that's the perspective that we take on it as Muslims, and that's the stance that we take on it. But when you're in that state of crisis, when you're in that state of overwhelmingness, you're not focusing on what's right and what's wrong. You're not focusing on the outcomes. You're focusing on what you're going through in the state of overwhelmingness or the state of panic or the state of crisis that you're actually presenting within. These are instances where individuals may have conditions like depression, persistent mood disorders, bipolar disorder, where they're in a depressive low and they've been like that for weeks, and it's a mountain and mountain and mountain, and basically it's gotten to a point where it's crushing you. And that's something that's very, very real. And when you see individuals like that, you try to explore different types of stressors with them. You try to explore what's going on with them. You try to see if they're willing to have a conversation with you. A lot of these conditions start out with having one conversation with somebody. And it's oftentimes really amazing what one conversation can really do. It's the start of, oh my gosh, this is what this person's going through, and here's the list, and this is the first person I've had the opportunity of actually coming forward to, because everybody's so busy and doesn't have time for me. And that's really how we see the world right now. Everybody's overwhelmed. Everybody's in a state of disarray. We've kind of thrown our usual means of coping out of whack. And so a lot of us are burdened with some kind of stressor right now. And so the fact that somebody's having these thoughts, they might not be willing to come forward to you out of the sheer fact that they have this perception that they're going to burden you with more. So they keep it boxed up to the point where it gets to them Googling methods, to the point where it gets to them purchasing things to conduct a means of ending their life, or to the point where it gets to them giving away possessions, writing wills. Writing wills isn't something that we take into account. It's something that most of us have done at some point, even if you are younger. If you've gone for ziyarah, yeah, well, I'm like, if you've gone for ziyarah and you realize the risks, I hate to say it, chances are you said, oh, if something happens to me, take care of this for me, please. In some capacity, you made things like that, but it's not to that extent. You'll recognize when somebody's actually feeling that depressive lull, they're out of their daily routines. They're not engaging in their daily activities. They're not finding things of interest to motivate them anymore. Basically, you're having somebody who might have been very driven in their lives kind of taken a step back, isolate themselves. You're not seeing them as much. They're not showering. They're not getting up in the morning. They're sleeping about 20 hours a day. So you're seeing depressive symptoms intertwined with that, as well as different types of personality disorders. So there are certain personality disorders that put you more at risk to suicidal ideation, suicidal thoughts, self-harm. And it's due to the movability surrounding those disorders, the means of coping, the method to which these individuals are able to cope. So there's a multitude of different factors that do lead to this. But I think the biggest thing is that we enable that conversation to occur. We allow these people to come forward, and we allow these conversations to happen. And one thing that I do like to make very clear is that you don't feel comfortable having this conversation with somebody, please don't. Direct them to somebody that they can have this conversation with. That's not a conversation that everybody's able to cope with or everybody's able to handle. That might be a trigger for yourself. If you're dealing with something on your own plate, you're not in the capacity to help somebody else. You're really not. And that's where we have to have that self-awareness piece and be like, okay, so what kind of resources can I access for this person?
It's true. Like me being a doctor, sometimes I get people who come, friends or family, and they really want to get counseled on various areas. But because I'm going to be biased as being family or friend, it's really a hard juggle to tell them that to look for somebody else. So that itself sometimes puts me in a very difficult position.
Yeah. And Yeah, no, I totally get that aspect of things where you have family and friends coming to you. When I do these conversations with the communities at large, I make it very clear that I don't actually friend a lot of individuals with whom I actually provide practice to, especially if it's in the community capacity, because it doesn't make sense. I always joke around with my friends. I tell them I don't run assessments on them, and that's kind of my go-to. Unless if they're in a state of crisis, different story. I'll have a conversation with them from a friend perspective, but it's you have to have that boundary stance. As providers, a lot of us get mixed into that and intertwined in that, especially in the communities where people are coming up to you. But it's recognizing that, you know what, you're not the only person there. There are other providers that are able to step into that role, able to take that space and able to take that away from you. And you're still able to follow up at the capacity of an individual that cares, as a loved one, as a friend. I'm not saying to take a complete step away from that perspective, but also recognize that there is a professional liability with that.
Otherwise, sometimes you may cause more harm than. Yeah.
Exactly.
So it is really important for us to understand that sometimes from my experience, maybe you can correct me, I've seen a lot of people who suffer from such illnesses is because of from where they have been brought up. Like if the family setting most of the times has violence within or some kind of suppression or so on and so forth, usually deprive them from the feeling that they deserve better in life, and usually that pushes them. Is that your experience as well?
Validation is huge. So there is, when I said that there is a hereditary component in certain types of mental health based conditions, there is. So oftentimes when there is a family member that's actually carried through with suicide, there is a high risk for somebody in the family in later generations to also experience that, especially if there's a direct link. So for instance, there's a maternal uncle that committed suicide about 5 years ago. That child that's currently experiencing a multitude of different stressors, inclusive of violence in the home, things that really enable that depressive symptom to come out and that symptomology to come and present. They're endorsing suicidal ideation. It's that much more risky in terms of their behavior patterns, because they've had somebody who's been genetically linked to them that has carried through and has actually gone through with it. So it does put you at a higher risk category. That being said, violence in the home is huge. I know that in our community, we have issues coming forth with domestic violence. We don't bring it up. It's a taboo subject. We don't throw our families under the bus.
Very taboo.
Many of us have grown up with normalizing different kinds of interactions in the home, violence in the home, whatever it is, in whatever capacity that we've seen it in, be it through our friends, through our own families, whatever it is that we've witnessed it in. When we've grown up, and we've often been told, no, that's not something you tell other people about. You don't tell anybody about this. It doesn't happen. We're a good, happy family, and that's what we look like, and that's how we're perceived as. You do that, and everybody else will talk, and there goes our reputation.
And nowadays we have the social media to play our fake play for us.
Yeah, 100%. And that's something that's very unfortunately persistent within a lot of our communities, especially within our Koja community at large. You have one thing go around the entire world in the span of a couple of hours, to be honest. And that's something that I think needs to change. These conversations do need to come forward. We have people who have suffered within violent households for years. And then what happens? Oh, they have major depressive disorder, and that comes about. And it's like, oh my goodness, I didn't know that person was going through that. They were laughing the other day with me. That's not their true self. That's a means of coping. And it's a means of normalizing how they've been dealing with that stress for years. Oh my goodness, this person actually, their child went and committed suicide. How did that come about? Well, let's look at the household structure. Let's look at maybe what they've been witnessing over the course of 20 years of their life, how they've been enabled in their homes or how they haven't. And it's a lot of these conversations are very sensitive. They do need to occur in a safe space. And that's why I appreciate the fact that you guys do have a safe space for these conversations to happen. Now, that being said, it's up to individuals who engage within these conversations in these safe spaces to uphold that. You don't go around manipulating that safe space. You don't go around manipulating those people. And I think that's something that unfortunately a lot of us forget about. We get caught up in the gossip. We get caught up in the conversations with our friends. When somebody confides to you in confidentiality, that's a conversation between you, them, and God. Khalas, it's over. Like, that doesn't go anywhere unless it needs to go somewhere to another healthcare provider, another service of interest, and that's it. That's not a conversation that comes back to the community. That's not a conversation that we have saying, oh my goodness, this person told me this, this, and this, and this, and did you know this about them? Doesn't matter. It's not relevant. They're an individual that's suffering right now. If you're going to help them, that's going to be your good deed for the day, and that's going to be a silent good deed that we've carried through. And that's something that I think is very, very important when we're abiding by these safe spaces.
Definitely, definitely. So I was going through the Quran, and I came up with this. I came through this verse in Surah 52, verse 48. Allah subhanahu wa ta'ala so beautifully mentions, "So wait patiently for the decree of your Lord, for you are truly under our watchful eyes, and glorify the praises of your Lord when you rise." It feels like Allah is directly connecting to anyone and everyone who's suffering at any stage of their life, whether somebody can see your suffering or cannot. But eventually, Allah can. So be patient, have faith, and seek help. I'd rather say that sometimes we might not be able to see, we might not be that lucky to be told by somebody that they actually feel, these low feelings. Nobody wants to tell you that they feel like they want to die and they don't deserve this life and they don't deserve all the beautiful blessings that Allah has given them. It's so hard to admit that, but it's a feeling that they have. And how can we, like, maybe you can share with the audience, how can we have indicators that can let us know somebody is going through such a stage?
Yeah, so
telling us.
Yeah, so I made mention of a couple of different things. So we oftentimes have different types of behavioral shifts. So these individuals might start regressing from certain patterns of behavior that they would have previously engaged in, be it they're giving away possessions, they're going about saying things where they're having conversations pertaining to death a lot more so than previously. They're having a lot of withdrawn habits where they aren't going out with you as much. Say, for instance, this would be somebody that you knew you can count on for a coffee once a month. This person's not going out for that monthly coffee with you. In fact, they're having very short one or two off conversations with you. They're very short in communication. It's more so, oh, no, I'm good. I don't feel like this month. Patterns of regression. Dismissal of care to self. So decrease in attention to daily activities. So you're not showering as persistently. You're not looking after yourself. You don't look like you're as put together as you might have previously been. You're saying you're tired a lot. There might be this dismissal of feelings. Oh, I'm fine. And oftentimes we say that's a very women thing to say when we're being passive aggressive. It's not.
Right.
A lot of people actually say it when they're, "Whoo, your lights went out." So a lot of people.
I'm on the dark side now. Okay,
there we go. A lot of people oftentimes say it when they're trying to downplay a lot of their feelings, and that might not be a conversation that they feel comfortable coming forward to as of yet. Other symptoms or other signs and symptoms include major depressive signs and symptoms. So eating less, eating more, weight gain, sleep patterns. So where you're having sleep patterns being altered. So either sleeping in excess or sleeping not at all. It's one of two extremes. But basically your whole lifestyle has basically been turned out of whack. And then we have the Googling of the methods, the attempts. Previous attempts actually put you at an increased risk as well. And it's very unfortunate that a lot of people actually don't come forward with their attempts if they do have a serious intent. So there's two folds to suicidality, really. There's suicidality for attention seeking, for lack of a better statement, to put it very bluntly. It's this invalidation. Oh, I got to do something big before people recognize what my worth is and that this is seriously impacting me. And it's suicidality and it's endorsed, but it might not be with intent. And that's where we identify, okay, let's back up here. Let's see what the triggers are. Let's see what's going on in the home, and let's identify that and work through that. And hopefully we can safety plan and mitigate the suicidal behaviors. The other extent is suicidality with an intent. And that's kind of where you get the cases where people won't necessarily come forward to you. They won't be having these conversations to you. It will be, maybe you catch the odd one that's very lucky to have had somebody run into them on the right day at the right time. And that's really what it is. And it's individuals who have been doing things over the course of an extended period of time. And it gets to a point where it's just too much, and they can't cope anymore. They can't see any type of future for themselves. And then that's that act finalized. And it's those instances where the community takes a step back and says, hey, we didn't know about this person suffering, because nobody stopped to even take a moment to focus on these small indicators. And it's small indicators, and I think a lot of those indicators are oftentimes within the home and within the personal life of that person. Now, that being said, there are instances where there are no indicators, and somebody might be very, very quiet about what they're going through, and they might shield that from everybody around them. And I think those are the ones that really hurt us the most, because those are the ones where we say, why didn't I know? Why didn't I see this? Why didn't I recognize this? This, and this. Oh, it's my fault. And we do that self-blame thing. In reality, it's not. There are only so many things you can do for these individuals, and there's only so much support you can give to somebody who is going through this. A lot of time it is self-initiated. That person has to be willing to come forward and has to be willing to get some help in some capacity. Same thing with addictions. You're not going to break a cycle of addiction if that person isn't willing to come forward. And in that means that helps us also come to terms with our own mental health and well-being, and our means of being really accountable to ourselves in that situation.
So the first step is acceptance from the individual themselves.
Yeah.
Without the acceptance, we cannot help in any way or form. Even if we try to, we may even take them to the counselor's door, but they might come back.
Yeah, it's
no help at all.
It's a willingness from that individual to engage in a means of getting better or helping themselves in some capacity, especially if there is an attention-seeking underlyingness to that person. If this is a means of coping, some people use suicidal self-harm. Some people use self-harm as a means of coping, and then what happens is that to some extent it's taken too far, and then we have accidental deaths as a result of it, and that's accidental suicide.
I've come across some patients who actually would try and come in the middle of the night at the emergency, and they would be suffering from physical symptoms like real pain, chest pain, whatnot, injury to themselves. What happened was, if you look through their history and talk a little more, after some time you gain some trust, you realize that it was just some source of attention-seeking behavior, whereby they wanted somebody to listen to them, and so they were ready for self-harm just so that the other person could listen to them, so that they could have a higher hand. But that way it puts a lot of strain into different relationships that a person can be having, because how often can somebody be patient with you? Like, if you keep doing over and over, there comes a time of you neglect such a person. You be like, this is your daily thing, I can't do anything more.
Yeah,
she's just faking it, that line.
That's very true with healthcare providers as well, as when we do see this as, for instance, a means of coping. So again, there's multiple layers to suicidality. There's multiple layers to the suicidal ideation, the self-harm. When you do see it as a means of coping for these individuals, when you do see it more without the intent, more so as an intention-seeking pattern of behavior, it's who's that attention really for? It's where's the invalidation? Oftentimes it's within the households, within relationships, within the life of this person. They've been so invalidated for so long that this is the only means through which they get that validation, and that develops into a coping mechanism for them. And it burns a lot of people out, especially when they are coming to the emergency room at midnight. I see people coming to the emergency at midnight, and we know them, we know what their routines are, we know how to engage with them, and we know how to cope with them. And that's a different level of interaction, because we know that with that person and we know what will work. And so there's some benefit, some silver lining to that as well, because then you know what their safety care plan is. the really big risk here is that one day it might go too far. And then you have that accidental death. That's a result of a suicidal attempt. But in actuality, it's not a suicide. It's an accidental suicide. And so that's when we get into the fine nitty-gritties of it and that conversation of having that with people. Okay, let's backtrack. Let's figure out what the means of coping is. Let's figure out what the stressors are, what we need to be validated within. And if you look back, a lot of it's to do with violence in the home. It's to do with violence in relationships. Obviously, a lot of women, a lot of men who just feel completely invalidated by those around them. There's been a dependency that's been created, and it's a very normal dependency within the homes. And it's dependency that, for instance, they've been invalidated by their dad for X amount of years, and they haven't been shown that love, and they haven't been given that household in which they can grow and flourish within. Or they've been invalidated in a relationship. They had a fallout with their fiance, and that fiance was with them for the past 6 years. And that's a big hit, because that's an invested relationship. That's something where you
too much investment.
That is really, because it's something where you poured your heart and soul into that, and now somebody's taking that away from you. You have trust concerns with other individuals now. You have this social based level of interaction that you're not upholding to in the full extent anymore. You're not being as persistent with those relationships. You're feeling invalidated. You're feeling like you
feel wasted.
Yeah, you do really. And it's like, what else is there? And you're feeling that hopelessness and that helplessness. So it's in those situations that you got to explore the stressors with those people. And that's not something that's done over the short-term period either. So in instances when we do see those people in the emergency room, that's oftentimes where they have to be willing to engage in additional support services that do provide them with the further means of coping over a longer duration of time, so that they're enabling themselves in order to support themselves going forward and change those patterns of behavior.
So this is going to be this has been really good and really enlightening. Thank you, Sarah. I think we can address a few questions that we have received. So one of the questions is that what is the relation between substance abuse and mental health or depression? An abuser who uses substance as an escape from a mental health situation, how would one deal with it?
Yeah, so as I indicated, there is a high level of overlap between the two. So oftentimes about 50% of substance use-based conditions do have some type of underlying mental health-based concern, or some kind of comorbid mental health-based concern, or some mental health-based condition that later persists in their life. So there is a link between the two when we do go into discussing how substance use does play into an individual. There's a genetic factor as well. There's a hereditary component. There's a societal factor. So when individuals use substances, it might be as a means of coping. It might be as an escapism. Engagement in hallucinogenic substances, recreational drugs that do take you out of your baseline. It puts you into an alternative reality through which you're experiencing something different. You're looking at the world differently. You're not feeling like it's crushing you anymore. You're not feeling like that low. And those thoughts aren't even there in that moment. You're on a high. Or you could be on the other end, you could be on an ultimate down and just be completely numbed out. And it's just not facing that reality. And that's really becomes the means of coping. When it comes to dealing with substance use, unfortunately, a lot of that's based over the course of months, years, a longer duration of time. And each individual is different. And that's something that we got to recognize. Each condition is different and each situation is different. And within those instances, we got to tie together that uniqueness of that person. Not one strategy is going to be able to be used across the board for everybody. Not one size fits all in these situations. And it has to be a willingness of that person to engage within activities for themselves. Substance use is really self-driven. So the motivation from that individual to engage within that action of quitting or lessening their use is really, really important, because that's not something that changes unless they want to engage in that. And that's oftentimes the hardest step, is going and accepting that as being a reality and a desire for change, and perpetuating that desire for change.
Okay. Another question is, what does a typical career in mental health entail?
Well, it's quite broad. to be quite honest. It depends on what area of mental health you want to go into and what career path you want to pursue. I pursued something that wasn't very conventional. I'm a psych nurse. And to be quite honest, in our community, I haven't met any psych nurses. So it's something that people didn't really have a means of throwing me within a career path and be like, oh, this is what it's going to look like. This is what your opportunities you're going to have. And I'm still learning it. So I don't know if I'm the best expert to give advice. But it is really dynamic. It depends on your interests. So if you're interested in the medical component, I do recommend looking at a clinician-based career. So be it a psychiatrist, be it nursing community-based support, or be it somebody that does clinical practice on their own, like a nurse practitioner. But it depends on where you're practicing and where you want to practice. There's different types of scopes in different areas of the world. Here, we don't have something that specifically trains you to be a psychiatric nurse. It's based off of experience, and it's based off of a subsequent level of interest, really, that you're pursuing that. And it's something that I'm really passionate about. I can't see myself in another area of nursing, so it's the area that I chose for myself. But basically, it's neat, for lack of a better statement. I really enjoy it because it's constantly evolving. It's constantly dynamic. You're able to pursue additional opportunities based off of your fields of interest. I got into community education, I think, a couple of years ago, and it was something that I was saying, okay, you know what, maybe there's a niche here, maybe there's an opportunity to engage with our communities at large. Oftentimes we bring on the psychotherapists, we bring on the counselors, but we rarely hear from clinicians that actually treat people in hospital, treat people with medical interventions, see them when they're at their lowest of the low. Because what happens when the counselor gets to a point where they can't engage with this client anymore, I get them. And so I see them in those situations. I deal with them in their extreme crisis situations. So it's a different means of helping that individual and providing them with support in that environment. The alternative side is more of the community-based support. So it's the social work aspect of things, the counseling, the psychotherapy.
I feel psychotherapy could be something as a preventive measure as well. For example, those undergoing already any difficulties within the family setting or the personal individual setting that could be disturbing them could immediately look for a counselor where they could confide in and get help immediately before they even cross the boundaries towards, mental health issues. So but what we do is after everything has been already gone down, and that's when we look for a psychotherapist. But that usually then is not only helpful, it's not helpful at all sometimes, because we leave out the medical part that could have also helped with coping. So I think it's hand in hand. Both have to work together for a better outcome. One other question is how effective is spiritual guidance or having faith in terms of coping to a mental health situation?
So I think it falls back on the holistic perspective. When we're in these situations of extreme crisis, that might not be our first thought. It's oftentimes a prevention piece to things going on, and it's oftentimes encompassing. Sorry, I'm just losing my train of thought. Just give me a quick sec. Basically, it's oftentimes the means of coping through which we're able to back up in our situations where that is a heavier impact in our lives. And that is more so something that does allow us to cope on the holistic aspect of things when we're more with it and take a step back from a crisis-based situation. In a state of crisis, that might not be your first thought. I mean, it depends on the individual and how persistent faith is within their daily routine, within their daily practices, within their daily interactions. It depends on how persistent that outlook on life is within them as an individual. And that's not to gauge spirituality or value spirituality in one individual to another, but basically that's to show you that in those instances, that might not be the focus that we're going down. That might not be the most persistent thing. In situations where this has been expanded over the duration of time, where we're going through depressive-based episodes, where we're seeing instances where individuals are having a hard time coping, yes, definitely spirituality is a positive means of coping. It's a protective factor for a lot of people. It motivates them to go forward, but it's this holistic perspective that we got to back up to. We also got to not throw out medical intervention at this point. We can't say, oh, spirituality will cure everything. God's given us cures, and they're through medications, they're through medical interventions, they're through therapies, and they're not just explicitly, oh, I'm going to go sit on a musalla and pray 50 rakats. That's not the end all be all at any given point in any of these instances, because it might not be sufficient enough for that individual at that time. And not to say that's going to work for everybody. It might. And again, that's up to the individual and up to the person and the personal, I guess, experiences of that person as well. How they've seen spirituality impact them, how they've coped previously. It's not to say that it's to be thrown out the window. It's comprehensive-based method of holistic-based practice. And I think that it does have a value and it does have a place within our communities, especially. But oftentimes we shouldn't let it replace alternative therapies and be the end-all be-all.
Definitely. We need to hold on to faith to actually be able for the medical and whatever, we are working on. But without the faith, even medicine sometimes fails. But alone, nothing is going to help. Yeah, we have to do it together.
No, agreed.
Yeah. So another person has asked, domestic violence or abuse versus mental health. Living in the same environment with one another, doing day-to-day activities with one other's presence, what would be the other alternative to tackle the mental health situation one is in? Or how could one adapt apart from seeking counseling?
Yeah, so domestic violence is actually a sensitive topic, and to be honest, I could spend hours talking to it because it's very complex, for lack of a better statement. It's got a multitude of different factors within it. It's not something that gets solved instantly. They say it takes, I don't even know, countless amounts of time to leave the individual who's actually insinuating the violence in the home. So these are cases where we have this concept of being trapped and being normalizing violence, really. And when you have conversations with these people, it's not even like they can recognize violence anymore. Oh, it's become a norm that my husband tells me that I'm worthless every day. That's not something that impacts me. That's not something that's important here. Oh, every once in a while, he like throws the kids out or he throws me out. And that's something that's very normalized in those environments. Why? Because we validated staying in those relationships for so long that it's gotten to a point where if we can't validate the reason we've stayed, it's actually playing on our inner feelings and inner inadequacies as an individual and the impact that we've had on our entire family. So to explore that is a separate topic altogether. But I think that that's not something that's oftentimes supported on your own, unfortunately. Those are instances that are very, very tough to deal with when you're alone. And when you don't have the right means of support, you'll never be able to leave those environments. You won't be able to come to terms with those environments that you've previously been in if you have left. And that's where you might speak to individuals who have been in similar experiences. I think that peer-to-peer sharing is really valuable in those instances where you do learn from other women or other men, because it's not one gender or the other. There is a more persistent aspect amongst females being domestically abused in the homes, but it's not exclusive. And that's something that I would like to bring forward. But when there's that peer-to-peer sharing, you do learn a lot more within those interactions, because those are actual practical stories that might be able to help you in those situations, as well as engaging with some type of community-based support, some type of counseling, some type of therapy, speaking to a provider, be it a one-off conversation that you've had with them, but ensuring that you do have a means of supporting you through that process. And I think to tail into that, one other aspect is how do we criminally charge that and go about the judicial system with it? It's not acceptable. It's not normal. It's not normal to have violence against you, especially in the home. That's completely unacceptable. In fact, it's illegal in a lot of countries. So we're going down the means of, okay, this is something that's against the law. It's something that's not accepted, period. So why are we being so hesitant when it comes to this? Would I be just as hesitant if somebody came down the street and verbally assaulted me? Probably not. but it's, again, this normalization within the home. Well, we've dealt with it for so long. What's another couple of years going to do? What's another 5, 10, 15 years going to do? It's really normalization within the house.
That is now causing a lot of issues for our youth and our future generations because of the normalization of it. But I think it's time that we all stand up for ourselves and, work towards a better future for our children, inshallah, so that they don't suffer what our previous generations have suffered through time. So as we come to the end of today's session, it's been really amazing to have you on board, and I'm really glad that we had this session. Also, I'd like to invite you to Virtual Safe Space. We're also working on an app whereby we want to include different counselors with alims and whatnot, majority of scholars in different fields who will accommodate youth in their specific problems, and whatever we are able to help, inshallah, we are ready here to serve as the community requires. But all in all, we need the support from people like you. As you said, we're one community, and also our viewers and audience would really love your support for us to be able to have a successful outcome for this committee.
Inshallah. And I wish you all the best success.
Thank you.
Because I know that you guys are working on the ground with so many initiatives. Virtual safe spaces, care spaces, I think, is also another one that's coming forward. And there's been quite a huge amount of mental health support. So kudos to you guys for taking that on.
Thank you. Maybe you could give us some closing note on your side.
I don't know what to say. It's been wonderful. I do appreciate the opportunity. I think you guys have really taken this to the new level and new extent with the safe spaces that you guys have been able to establish with the virtual networks through which you've created, and bringing on experts and mental health providers and mental health practitioners into these conversations. And for that, I am appreciative, and I think that this is a great opportunity for individuals to ask questions and a great platform for them to engage in. So I wish you all the best and all the success with it, inshallah.
Thank you. Thank you so much. Thank you all for joining in, and inshallah, please remember us all in your duas, and we will do the same, inshallah. Thank you again.
Thank you.